Good afternoon. I'm David Sweat with the Shelby County Health Department and the COVID Response Unit, and I'm here to welcome you to the Joint Task Force briefing for the Shelby County and City of Memphis COVID response. As far as where we are today with data, we've had 27,865 cases of COVID-19 disease reported in Shelby County since March, and we've had 387 deaths so far. The median age of death is 74 years old with an age range of 13 to 100 years. Recently, yesterday, in fact, we were doing some analysis of the recent surge that we went through in the month of July to analyze better what was driving, or which demographics and which geographic areas were driving those increased numbers of cases that we experienced in the month of July, which was our highest month of the epidemic. And what was very clear from that analysis is that far and above any other age groups, the persons who were 21 to 30 years of age were the driving force in this surge in July. And what that means is those people 21 to 30 years old were more actively acquiring and transmitting COVID-19 than any other age group in our population. And that's an important thing for us to recognize as we head into the holiday weekend, because the number of people in that age group in July was driving our cases and continue to be important demographic for where the virus is spreading most actively is among people in that age group right now in Shelby County. We have 2,485 currently active cases, meaning these are people that have been diagnosed within the last couple of weeks, and they're open cases under investigation. Their contacts are in quarantine, they are in isolation, and we continue to monitor their condition. But that is a big improvement for us from the month of July. There were times in July when our currently active number of cases exceeded 6,000 cases. And so for us to be down to less than 2,500 cases active today is an improvement. And over the last 2 days, each of the last 2 days, we've had less than 100 new cases reported. So we've had 86 cases and 82 cases reported per day over the last 2 days. And that's another sign of improving conditions. So we want to congratulate everyone who are wearing their masks, who are practicing social distancing, who are practicing hand washing, and being responsible for helping us as a community see our numbers improve in some key areas. We do see that our minority populations continue to be overrepresented in the case counts and across the board. So 80% of the people who have been diagnosed with COVID-19 disease in Shelby County are either among our Black or our Latinx communities, and 83% of our pediatric population that has been diagnosed come from those communities as well. So those are both overrepresented in the number of cases, they're also overrepresented in the number of deaths, and also in our pediatric populations. So while all communities, every demographic by race or age are affected by COVID-19 disease, we do recognize and have recognized for some time that our minority populations bear a disproportionate burden of the impact. When we look at our deaths, this week, earlier I was asked some questions about analysis of the death data by the Centers for Disease Control, and wanted to comment on comorbidities for a minute, because throughout the epidemic, you've heard us talk to you about the importance of comorbidities in overrepresented in our deaths. And there are three key comorbidities that we see represented among people who have had fatal outcomes. The most important of those are cardiac conditions. That can be heart disease, congestive heart failure, it can be high blood pressure, any number of different cardiac conditions, but 77.8% of the people who have died from COVID-19 disease have a comorbidity related to heart problems or cardiac conditions. We also see 40% of the fatal cases have been diabetic, and 25% have had some sort of underlying respiratory condition. All of those comorbidities have been recognized since the beginning as things that increase the risk of death. What the analysis that was done earlier by the Centers for Disease Control looked at the prevalence of comorbidities among fatal cases and also asked the question, what percentage of the deaths had no other risk factor or comorbidity associated? And what they saw was 6% of the cases had no reported comorbidity. Some people have reached the conclusion from that therefore only 6% of the COVID deaths were actually caused by COVID. And that's not correct. A person with an underlying comorbidity who dies from COVID still died from COVID, and their comorbidity increased their risk of death. What the CDC data does show, though, is that even people who have no underlying risk factors that are identified, people who have no comorbidity at all, can still be fatally impacted by COVID-19 disease. So that is something that Dr. Randolph may want to speak more to as well. But we recognize that comorbidities do increase the risk of death, and that a death in a person with a comorbidity is still a COVID death if they were infected with COVID disease. As far as our deaths, another thing to recognize, as we've seen and said several times, that 88.6% of the people who have died in Shelby County are 55 years of age and older. So we know that people who have those underlying conditions, but also people who are 55 years of age and older, are at an increased risk and are overrepresented in our fatal cases. So as we head into this holiday weekend, we want to appeal to all Shelby County residents to take seriously the measures that are outlined in Health Directive number 11 and practice the good practices that we have been promoting all along. We would like to make sure that people remember that whenever you're out in public, you are required in Shelby County to be wearing a mask. Also, we want you to practice good hand hygiene, wash your hands frequently with soap and water, or use hand sanitizer frequently if you don't have access to soap and water, and to avoid large gatherings, to practice social distancing, and in general, take all the precautions you can to make it less likely you become infected with COVID-19, and less likely that if you are infected, you can transmit that virus to other people. But we want to particularly challenge our people who are 21 to 30 years of age. Please be responsible. Please avoid gatherings where social distancing is not possible or easy to maintain, and to wear your mask, wash your hands, and protect yourselves and the people who are your relatives, your friends, your family members, your coworkers, who are at increased risk, either because of an underlying condition or increased age above 55, of fatal outcomes. We can get through this together, but we need to work together to do so. And with that, I'm going to turn it over to Dr. Randolph, our health officer, for further comments.
Thank you, Mr. Sweat. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for Shelby County Health Department. I'd like to just, echo everything that Mr. Sweat had stated. Looking at the numbers, we're making great progress. We're not where we want to be, but we're headed there. I say that because this weekend we will be having a football game. Also, Monday is Labor Day holiday, and we've already resumed school. So these are three potentially challenging events that could increase transmission, but it also can show that the safety measures that we have in place work, and that we do not experience any increased numbers as a result of these events. Therefore, we could then continue to move forward. Now, I want to just make it clear so that you understand that we would not be making any changes to the health directive until approximately 2 weeks after Labor Day. Now, why is that? It's because the incubation period for this virus is 14 days. And so we feel that if we monitor things for 14 days after this weekend and Monday, that would give us a good idea of the degree of transmission and if there's been any uptick in the transmission. And therefore, we're able to proceed with making any revisions that's necessary in the health directive. So we won't be making any until approximately 2 weeks after Labor Day. One thing about the game that is coming up, University of Memphis is playing, I want to encourage those who attend, please adhere to the safety measures that the university, in cooperation with the Shelby County Health Department, have put in place to keep you safe. Adhere to the 12 feet separation, wear your mask, and follow the other instructions that you're given. We are attempting to try to have some return to normalcy. There are some schools in the ACC, in the American Athletic Conference, that are not allowing any fans to attend the game. We feel that we could allow some to attend if they adhere to the 12 feet separation and wearing of the mask, facial covering. So we're asking that you adhere to this so that we can continue to allow fans at the games, and we would not have to revert back to more restrictive measures. Now, there have been some questions around the issue of quarantine, isolation, and contact tracing. And I just want to address this briefly. Quarantine, which is primarily to put someone to separate someone who's been exposed to someone who's infected with COVID-19, to separate them from other individuals for 14 days. That is a legal act that the health department, specifically the health officer and the health director, are given through state statute. Now, we welcome and we encourage, and matter of fact, the health directive requires employees and even individuals, along with healthcare providers and laboratories, to report to us any positive cases. So if you are a school or any other employer, and you know that you have employees or students who test positive, we ask that you certainly report that to us, though we also should be getting the reports from other sources as well. But determining who are subsequent contacts and who should be placed in quarantine is a decision that the health department makes. Now, we ask that you help us in identifying individuals who may have been exposed And if you identify those individuals, you may restrict them from coming to school, but placing them in quarantine is a responsibility and a determination that the health department would make. Likewise, releasing them from quarantine is something that only the health department, the public health officials, the directing health officer has the power and authority to do. So I just wanted to clear that up because there's some confusion going around, and there are some entities who think that they can create their own quarantine and contact tracing policy, and that is not the case. With that, I will stop and open up and entertain any questions you may have.
Sam Hardiman, Commercial Appeal.
Hi, can you hear me?
Yes.
My first question is for Dr. Randolph or Dr. Sweat, or both. Would it be fair to characterize how the population performs over Labor Day weekend in terms of social distancing as an inflection point for how the region goes forward with the virus? It happened after 4th of July weekend last time.
Yes, of course. I think this is a very important point in our response to the pandemic. How things turn out this weekend and the subsequent results of the activities of this weekend will determine which directions we go in the future. If we experience continued decrease in spite of the events that have taken place this weekend, would be great. I mean, it will let us know that we're on the right path. We're doing the right things. Let's keep doing this so we can open up more establishments and resume some activity. Now, let me just be very honest with you. Things will not return to the way we used to do things in the past. It'll be a while before that happens. You know, the days when we would all crowd in bars or crowd in movie theaters or crowd in anywhere where we're shoulder to shoulder in close contact. It's going to be a while before those types of events take place. But what we will be able to do is to do some things. We just have to do them in a safe and sensible way, and realizing that, hey, we just got to separate 6 feet or more, wear our masks, practice good hand hygienes, etc., and then enjoy life to its fullest. Is there a follow-up?
Yeah, my follow-up would be, if we get on the other side of Labor Day, the 2-week window you talked about, and the case rate is roughly the same, but the positivity remains above 10%, would the health department allow limited service restaurants to open?
That is to be determined. If you look at the health directive points out parameters for improvement, and if we meet them, then we use that as a guide to make revisions to the health directive. And so we're not saying that we will necessarily require all 5 or so of those parameters to be met before we take some action. But we will look at the trend in them and then make a judgment at that time. So we're not saying hard fast that if that number is reached, then absolutely everything is reopened.
Kendall Downing, WMC.
Hey everyone, my first question is regarding the Labor Day holiday and everything that you kind of expressed as being at an inflection point. I know Director Haushalter had said that you really have to consider it's not just maybe going to events, but also considering some of these small family gatherings that people may be going to. Could you expand on that a little bit, the consideration for events this weekend? And then I have a follow-up.
Yeah. I want to just remind people that, transmission of the virus can occur in a crowd of 3 as well as a crowd of 300. And so whether you're in a small crowd, a large, you still need to practice the safety measures that we have in place. So if you're in your backyard, hanging out with your family members, friends, neighbors, or whoever, I encourage you still to practice the social distancing, 6 feet separation, and the wearing of the mask. So whatever setting you're in, home, backyard, at the grocery store, even, if you happen to be one of those who venture to the game, practice the social distancing and the distance separation that we're encouraging you to do, and wear your facial covering and your mask.
Thank you. And then the other question, I know that we're, some time away from this, but, the CDC is telling states to be ready for a potential vaccine rollout November 1. Some of the vaccines are in pretty late stages, and we should be knowing more about if they'll be effective. Obviously, lots of layers to peel back here from, a Shelby County perspective, but could you all just give us an idea of, how does that vaccine work out? How would it even roll out here locally? Does it go to at-risk populations first? Is it done through a testing center model? What's the kind of idea, or what does the strategy look like that you could at least tell us from a pretty far back level? Thank you.
I'm going to have Mr. Sweat to speak to that because he is over the public health emergency response program as well as the COVID-19 program, and that particular process, distribution of vaccines, falls up under his authorization.
So thank you for the question. Actually, this morning we had a planning session about what we're calling our dry run for distribution of COVID vaccine, and it's going to be utilizing drive-through points of distribution in a couple of locations where we'll use the influenza vaccine as the surrogate for a COVID vaccine, but we'll be working to set up some sites and publicizing those for November, where across the entire state of Tennessee, under a program called Fight Flu TN, that will be doing some dry run vaccination distribution. And so stay tuned for more of that. But in terms of the COVID vaccine, what was asked for by the Centers for Disease Control to the states yesterday is that the groundwork to be laid, right? And so whenever we're setting up points of distribution or making plans for how vaccine could be distributed, sites and all that sort of logistical detail, there's a long lead time sometimes to set those up, to get the permits, to identify the locations, to make sure that everybody understands where they will be, and we have all the elements in place to hold an event to do distribution of vaccination. So the instructions that we've received so far about the first doses of any candidate vaccine will really be targeting toward the essential workers that are in safety and law enforcement and healthcare settings. People who work in specific key roles will probably be the first people to be offered the vaccine. But at this point in time, there are a number of candidate vaccines that are under development, and different vaccine manufacturers are still going through their clinical trials. So at this point, we don't have a candidate vaccine. We do not have a vaccine that has demonstrated efficacy. But what the CDC is asking us to do is lay the groundwork so that we're ready for when a vaccine does become available to us, that we've already been planning on how and where that distribution would occur. And as I said, in practice for that, we're going to be co-locating flu vaccination into some of the community test site locations where people are coming to be tested, and maybe other locations that are appropriate to set up drive-through influenza vaccination, but it really has a twofold benefit. The first fold is, of course, it's a flu vaccine, and we encourage everyone to get a flu shot every year for the annual flu epidemic. And so this will be an opportunity for people to get a flu shot, and that would protect them for the flu. But it's also to test our strategies for deploying drive-through vaccination for COVID-19. Now, one thing that we do see in the proposed candidate vaccines, all the ones under trial, that they are multi-dose. And as part of the vetting of those, what that means is you vaccinate some folks, you have to wait a few weeks, then you test them and see if they've developed an immune response, and you give a second dose and wait a few weeks and test them to see if that boosted their immune response to the vaccination to show its efficacy. But, with the flu shot every year, for most people right now, that's what we call a monovalent vaccine. You get it one time, but it only has to be administered a single time. But for the proposed COVID vaccines, these are two-dose vaccines that are all under development, meaning people would have to get a first shot and then come back and get a second shot after a period of time. All the vaccines that are in development will work that way.
Jane Roberts, Daily Memphian.
You help me with that response. I'm going to withdraw my question.
Okay.
We'll go to Brad Broders with Local 24.
Good afternoon, everyone. Thanks, Leah. For Dr. Randolph, I have a question. I know you were talking about the next 2 weeks about the health directive after Labor Day. For Memphis Tigers football fans out there, what would be the chance that potentially more attendance would be allowed inside the Liberty Bowl? Would that be a potential consideration for the directive? And I have a follow-up.
Currently, that would not be a factor in terms of our decision to change the 12 feet separation. I think that 12 feet separation in a sporting event where there's cheering and yelling and loud speaking, we feel is the appropriate distance until data suggests otherwise in terms of the transmission of the virus. So the 12 feet separation requirement will be with us for a while.
Thanks. So as a follow-up, I know there's obviously going to be a lot of fans who won't be going to the game because they can't, but might be at some outdoor venues, whatnot. Do you anticipate any extra enforcement to just make sure that capacity rules are there as folks are watching the game on Saturday evening?
But one thing I want to remind people is that tailgating at the Liberty Bowl Stadium parking lot is not permitted or allowed. Certainly we will have folk just monitor to see how well things go this weekend at the game. What people do in their backyards, of course, we're limited in our ability to, monitor that. We're simply encouraging people to adhere to the safety measures and practice the social distances. I would imagine that the only time that we would investigate a situation like that is if we got a complaint from some neighbors that there's a large crowd of people gathered at a particular establishment, house, or what have you, and there's blatant violation of the safety measures.
We are out of time. Are there any closing messages?
The only thing, again, we just want to reiterate the fact that we are making progress. The mass up Memphis, mass up Shelby County endeavors are working. Let's stick with it. Let's not go back. Let's not make the mistake that we did in July during the 4th of July celebrations. But let's continue to move forward so we can reopen all our establishments. Be safe, and God bless you.
Thanks, everyone. We'll see you back here next week.